Yeah, so I applied for both at the same time.
Okay.
Yeah, so I think at that point in time I wasn't sure which one I want to go into yet. Yeah, so like I sort of like prayed lah. I prayed and then asked God. I say, God, which one do you want me to go into?
Yeah.
Say then you just open the door for me. Yeah, so I prayed and asked. Then after that, what happened was only one door was open, which was NUS. Yeah, so my application to SIT wasn't like successful at all. Oh, why maximum is 30 minutes?
I don't know Okay, anyway, we can just start already. Yeah.
Oh, okay.
I don't know also. I mean actually I know because they didn't, because of the whole camera and video camera type of there's this tax if they allow people to, let's say they allow people to record more than 30 minutes, right? Then they will consider a video camera. Then the camera will be more expensive. Then they market it to as a video camera. Then it may jack up the price and people don't want to buy. So there's limited at $29.59 so that it's considered as a DSLR camera.
Oh.
Yeah.
Oh, I didn't know.
I think it applies to, I'm not sure the Sony will apply or not. Because you have a Sony, right?
Yeah, I have a Sony. I think it doesn't
You will try it. Just like record for like.
Oh, I never tried recording for
straight.
very long lah.
You just try. I think go later, yes, right? We just put 1 hour straight.
Really? Okay. I try. So yours will cut off by itself?
Yeah, correct.
Oh, okay.
Yeah, I cannot hear you.
Can you hear me? Hello?
Oh yeah, I can. Okay, I think I'll do soft.
Yeah.
Okay, man.
Okay.
Welcome to the podcast.
Thanks for having me.
This is a new episode after quite a while. After 1.5 weeks. Because last week I was supposed to have you right last week.
Yeah.
Then after that, I had the COVID test. Then it's negative. Then, okay, nothing is fine. Then I think it's go ahead already. Yeah.
Only you went, or did your whole family went also?
Oh yeah, they all went already.
Oh, they all went already.
Yeah, I don't know why my parents signed up earlier, right? Sorry, later than me, right? But they got earlier slot.
Oh.
Yeah, I signed up on the night I tell you, right? Like last Wednesday.
Yeah.
Then after that, I booked the Saturday slot. Then they give me like next Wednesday slot, which is last Wednesday. But then my parents booked it on like Friday. They got it on like Sunday. Yeah, so it's like I don't know what's happening.
I think it's the age lah.
Yeah, but they vaccinated already.
Oh.
So it's like
okay.
I don't know, but yeah, negative. And I didn't like. Have you got swab before?
Yeah, I have once.
The nose one, right?
Yeah.
Uncomfortable, right?
Yeah, uncomfortable.
How many had to go so deep?
Huh?
They go so deep,
Yeah, you have to go all the way into like your nasal cavity.
I feel like they go only here,
Yeah. It's like you can feel it like between your eyes, right?
Yeah.
That kind. Yeah. It's very deep.
Yeah, and they both nose, right?
Yeah, both nose.
Both like, walao, I cannot.
Do you tear or not? Like it was or never?
The person asked me, is this the first time? I said yes. Then I thought, okay. Then he said, okay, so this may be a bit uncomfortable. Then I said, okay. Then he went in there. Why so deep? What's going on? Why don't you stop? Then he go all the way to the end. Then he move a bit.
Yeah. They'll turn, then come out, then go inside and turn again.
Yeah, and I thought, okay, over already. The other side.
Yeah, the other side. Yeah.
Okay. Yeah. But where do you do your swab the time?
There was once that I had to do my swab last year.
Yeah.
Because it was after my third year, doing the holidays, after year 3 lah.
Okay.
While waiting for year 4, in between the long break, like now lah.
Oh,
like
2020
yeah, 2020.
Last year lah.
Last year.
Okay.
After May lah, June, July, August.
Oh yeah.
The 3 months break lah. Yeah, then because last year was the COVID outbreak, then there was a lot of cases in like the dormitories.
Yeah.
Yeah, then I volunteered with my school to do COVID testing for these dormitories.
Oh, you helped them to do COVID
Yeah, I
testing?
went. Yeah, but it's not the swab because there was a swab and then there was one that's a blood taking one.
Got blood taking one?
Yeah, got blood taking one, like the serology test. Yeah, so basically you test whether they have like COVID antibodies in their blood.
But how much blood you need to take out?
1 tube lah, which is like 5 mils.
Oh, so it's like over here.
Yeah, have to take blood for them. Yeah, so they segregate lah. So my school partner with NUHS, which NUH lah. Yeah, then we take care of like the dormitories in the west side.
Oh, we here lah.
Yeah, we got one here lah, the west side one. Then got a lot in Tuas lah. There was a lot of dormitory in Tuas.
So every day you start what time like that?
Yeah, around 7. 7:30.
7 a.m.
Yeah.
Oh shit.
Yeah. So we report to school. Then the school, so we just take this like shuttle bus.
Yeah.
Yeah. Then the school will bring us to the dorm. Yeah. So all the way until like maybe 2-3 p.m. like that.
Okay.
Yeah. So I think the most difficult part was because you have to wear full PPE.
What is full PPE?
Full PPE. So you have to wear, you have to wear this gown.
Yeah, I saw.
Yeah. So you have to wear this gown. you have to wear gloves, then you have to wear N95, then you have to wear the face shield also.
Walao, then
Yeah, so it's like really just everything just covered lah, basically.
Won't you be like sweating inside?
Yeah, confirm sweat one. The moment I put on, right, I perspire already.
Walao. Then must put your name here, right? So
Yeah, correct. Yeah, must write your name here. Because you put on a mask, everything, right, everybody look the same one, so you cannot identify.
But why must I wear N95? Why cannot wear the normal surgical mask?
Because it's a different grade.
Okay.
Yeah, so like normal surgical N95, right? The what you call that? The size is different.
Oh.
So technically N95 is more safe lah.
But
Yeah.
have you learned how to wear? Because I heard that N95 mask, right, is you must learn how to wear it, right? There's a specific way of wearing it. Or there's a specific fit to someone's face.
Correct. You must go for mask fitting lah.
Oh, so you went lah.
Have to go for mask fitting. Yeah, because some people the face shape is different.
Yeah.
So N95, right, there's small, there's normal size.
Uh-huh.
So if you cannot fit these two sizes, right?
Yeah.
Then there's another one.
Sorry, small and what?
Small and normal size. Normal size and small. And then there's also another product. If you cannot wear lah, there are people that really cannot wear the N95 one. Yeah, then they have to wear another one. There's a replacement for it. But it works the same way as N95.
But that means your face will be very big lah.
Yeah. Some people face either too big or too small.
But if it's too small, you got the small one, right?
Yeah, some people still cannot.
Still cannot.
Yeah, because how they do the testing, right? You wear the mask and then they spray this very like smelly kind of smell.
Okay.
Yeah. So if you wear the mask and you can smell it, that means it's not fitted.
Oh, but how? What? But you cannot smell yours lah.
I cannot.
You wear what normal?
I wear the normal one.
But you really cannot smell anything.
Yeah, really cannot.
Oh. Wow.
Yeah.
Wow, so stringent one lah.
Yeah, it's quite stringent lah. It's quite stringent.
Okay.
Yeah.
But they do it for entire. Sorry, this volunteer is a Moscow one or like really a volunteer?
No lah. They reach out to the students to see whether they want to do or not.
Oh.
Yeah, and it's paid some more. So
really?
Yeah. So why not?
How much they pay you?
I think if I remember, it's 18 or 20 an hour.
Oh, not bad. What?
Yeah.
For how many weeks? 2 months or what? Sorry.
Yeah, around 2 months.
Oh, not bad. What?
Around to 2 months. Yeah. So my whole holiday was spent doing that lah.
Okay. What?
Yeah. Some of that period was like what, phase 1 or phase 2 after the lockdown. After the lockdown. So like you cannot really go out and stuff like that. So yeah. So why not lah?
But you work from 7:30 all the way to 5 or what?
No, until 2 to 3 p.m.
Or they change shift?
Yeah. No, that was the only timing.
Oh.
Yeah, so on a given day itself, they have like let's say today we only have 100 packs.
Yeah.
Or today we have 200 packs. So once you finish, you clear, you can go off already.
Also, you must hit the target.
Hit the target, yeah.
Okay.
Correct.
But your job role was to do what? To really to extract the blood or this thing?
We just have to draw blood for these people. Then we have to send it off to the lab lah. Then the lab will test.
Okay.
Yeah, so if there's any like positive or non-positive, then they will follow up with the dorm lor.
How fast is it to test this?
Quite fast. I heard it's only 1 to 2 days.
Okay.
Yeah. Because during that period I think there was a lot of mass testing lah. Not only in the dormitories lah. Yeah, like other places also.
Was it scary? You put a syringe, like you're gonna poke something.
I mean, I wasn't scared lah, but the people there were scared lah.
The people there?
Like the workers.
Why were
like,
they scared?
They say like, because I think some of them like, okay, some dorms, right, like the manager never really explained to them properly. Yeah, like you know, like what they're gonna do.
Go for test.
Yeah, just go. Yeah, you know, that kind of thing. So when they sit down, then they say, oh, I need to take a blood today. Then they, need to take blood. Yeah, so like they won't breathe properly lah. So you have to explain to them. Yeah, so we're here to check whether you got exposure before lah to COVID and stuff like that. Yeah, so some of them also quite scared of like taking blood. Okay. They're scared of needles and stuff like that. Yeah.
But how they choose who to take blood and who to do the nose one?
Yeah, the one I'm not very sure lah. How they do, but I think they do both. If I'm not wrong.
They do both.
Yeah, I think they do both.
Okay.
Yeah, so I think for them it's quite sian lah.
Yeah, man. Cause like I don't get why would they have to do both. Then for us we only do the nose only.
Yeah, exactly. Because I think that time it was outbreak, so they wanted to find out who has exposure to COVID before. Okay. Because if you have been exposed, your body will have antibodies. Yeah. To the virus ma. So they wanted to see like, maybe this group is exposed to virus before. Okay. Yeah, and stuff like that. So if you don't have, maybe they will just segregate those that not exposed to the virus before. Okay. Yeah. So I think quite sian because I asked them like, how often do you have to do this? I think they say once every 2 to 3 weeks.
It's like a normal like working in a hospital. Right?
Yeah, correct. Yeah. Wow. So for them quite sian. And somehow they are stuck in the dorm. Yeah, man. And they cannot do anything.
Now they are still stuck, is it?
Now I think not. Yeah, not as bad as last year, I think. Yeah. because I asked them like, oh, just like chit chat with them lah. Ask them, oh, so what do you do on a normal basis?
What do you do?
They say, wake up, then go
TikTok.
down, doing dance, you know, not bad. No lah, I think they say that they wake up, they go down and then take their ration lah, their food ration. Then after that go back to their bunk and eat. Then I think most of the time they just like on their phones or
Wow,
then
quite sian
until lunch, then all the way until dinner, then the same routine every day.
Wow, very sian eh.
Yeah, really very sian. Yeah. And some of them like because they cannot see their family
Yeah.
overseas, then they just like FaceTime or Skype, those kind of, and that's like their daily routine. For like don't know how many months I think.
Yeah, man. Now it's
Yeah.
really, I mean, now really go maybe 1 year.
Yeah,
already.
1 year, yeah, that's why. Quite sad lah, quite sad.
Yeah, man. So okay, what do I forgot to introduce yourself. Yeah, I forgot to introduce you actually.
Oh.
Yeah. So today we have Jonathan today. I know it's a bit weird to stare at the camera like that. I also find it weird. Yeah. So anyway, anytime you don't feel comfortable, you can just take out the headphones and you go toilet or go water, just tell me. Then we just
Okay.
pause. Yeah.
Can.
And you can just get comfortable and then just like lean back or anything.
Okay. Can.
Yeah. I feel like the camera is not is it straight? Yeah, I think I need to move a bit more to you, sorry.
Okay.
Okay, yeah, I think this is more centralized.
Can. I cannot really see myself.
Yeah, I can see.
Yeah,
I can see.
yeah, you can see.
Yeah,
You can see. Can
already. Yeah. Okay, so why don't you introduce yourself, Jonathan?
Oh, okay. Hi, yeah. So my name is Jonathan.
Yeah.
So what else in intros? I just finished my studies at NUS lah. Yeah. So I took nursing in NUS. Yeah, 4-year studies lah. So just completed lah.
Yeah, man.
Yeah.
How do you feel?
Yes, finally. Finally, after
4
so much
years.
years of studying.
Yeah, man.
Yeah, I really cannot wait to really go out and study. No,
To
go and work. To go and work. Yeah.
Yeah, man. Wow, 4 years of it. Okay lah, but why did you choose nursing?
Okay lah. This is a question that I think
Yeah.
a lot of people have asked me already lah.
Yeah, actually,
Yeah.
I know you since secondary school, and then in poly you're doing biotech, right?
Biotech.
Yeah, and after when I heard you go nursing, I'm like, well, I don't understand why. Yeah. So why don't you fill in the gap? Yeah.
Okay. Yeah. I mean, in poly we were doing. Yeah, I was doing biotech lah.
Yeah.
So I think at that point of time, like I think a lot of us like after O levels, like what do we do?
Yeah.
You know what to study. So I think first instinct a lot of us choose is what interests me.
Yeah.
Like what is exciting or what do I want to know more about. Yeah. So I think to me is I want to know more about science.
Okay.
Yeah, so like I was like quite interested in like doing science. Then going to like poly, the open houses. Then you go through the different what's that? The booth,
yeah.
and stuff like that lah. So they were saying like, biotech actually quite interesting lah. You get to learn about the different lab stuff. And we also offer like forensic sciences. You can major in different things. There was like marine bio.
Okay.
Yeah, then there was lab. And then there was forensic science and stuff like that lah. So to me when I first heard that at like 17 years old, I was like, oh, okay, quite interesting. Then so I just decided to give it a shot.
Okay.
Yeah, so I think at that point in time I didn't really pay much prospect to like what will the future be like. Yeah. Like after I get this diploma, will I be able to find a job? Or would that be a like attractive job in the future?
Yeah.
Yeah. So
that's normal.
So I think as I went through like 3 years in this course, right? Yeah, I felt like I got cheated lah.
Huh?
Yeah. Okay, not say cheated. I mean they promise like, you learn a lot of interesting things. Yes, you do learn a lot of interesting things lah.
Okay.
Yeah, but I think what was maybe light too about was maybe like the prospects after you get this diploma.
What did they say?
So they'll say like, you have a very interesting career.
Okay.
Like a lot of like labs will want you. You will work in like different labs. Yeah, I mean, yeah, you'll be able to do so. Yeah, but actually the prospects is not that great lah. Yeah, they didn't really say that. If you want to be like a researcher, and stuff like that, you have to at least have a degree or even like a PhD, a master's or a PhD, in order to like to do research in lab. Yeah, if you only have diploma, guess what you end up? Just as a lab tech. Yeah, lab tech. Or like even you have a degree also, you also end up as like a lab tech only. Yeah, so I came to realize that because during the final year we'll go for like our internship, right? Yeah, so I went to a lab. So at that point of time I was an intern there. Then they hired a new fresh grad.
Okay.
As well lah. So I think she studied life science in NUS, I think, if I'm not wrong. Yeah, then like she joined the company. Yeah, so I asked her, oh, so like what do you plan to do? Yeah, with your degree and stuff like that. Yeah, then she said, I also don't know. Yeah, she said, I'll see where this takes me lah. Because she said she also want to do research.
Okay.
Yeah, but she knows that she has to study to at least a master or a PhD.
Yeah, correct.
In order to do so. Yeah, so she said like, I cannot really find much job. Yeah, except a lot of technician job like lab tech and stuff like that. So she just decided to just go ahead with it to just apply for a lab tech.
Okay.
Yeah, so to me at that point in time I was like, I studied so hard, then I don't want to just end up as like a lab technician. Yeah.
But you have thought to go to have a degree lah.
Yeah, I thought of doing life sciences also.
Oh,
yeah.
Okay.
In degree lah.
Yeah.
Then after that to go and work. Yeah. Then when she told me like, I diploma, I can become a lab tech. Then if I take a degree, I also become a lab tech. So like, what's the point of me like taking a degree to become a more qualified lab tech? You know, it doesn't make sense.
Get more pay only lah.
Yeah, higher pay only lah.
Yeah.
But I think the prospect wise is still the same.
Yeah.
You know, you're still doing the same job scope and stuff like that. Yeah. So at that point of time, it just occurred to me like, if I really go and study this degree, right, it'll be quite a wasted 3 to 4 years, you know, that kind of thing. Yeah. So I think at that point in time, I just started to think, you know, like what other choices do I have? Yeah. If I want to take a degree, like what can I do?
Yeah.
Yeah. So at that point in time, I still didn't really have an answer. Yeah. Okay. Until I went into army. Yeah. So I was like posted to a medic lah. Yeah. Then that was, I think, the first time when I was exposed to like healthcare or healthcare related stuff.
Okay.
Yeah, so I think at that point of time I was like, actually not bad lah. Like quite interesting. Like you get to do, you get exposure lah to like the healthcare related stuff, like the skills that you do. Yeah, I mean, although like the skills you do as a medic and as a nurse is not really similar, but there's still like certain things that is still the same lah. I would say. Yeah, so some skills you still can apply to nursing. Yeah, and also, being a medic, right? You have a lot of like other soldiers who were from nursing before.
Oh,
yeah,
true.
so like a lot of them were like from diploma nursing.
Yeah.
Yeah, so then I asked them like, how is it? You know, and stuff like that. Yeah, so they shared with me their experiences lah. So I think through that, it really piqued my interest into, actually nursing could be something that I can consider.
Okay.
Yeah, since I already medic and I pick up some of the skills already, then like why not?
Okay.
Yeah, so after army, during army lah, that was when I decided to like, let's give like healthcare a shot.
Okay.
Yeah, but at that point in time, it wasn't really nursing yet. So I was still quite open because, you know, in healthcare, there's like radiology, there's like physiotherapy, there's occupational therapy. So there's a lot. So at that point in time, I wasn't really decided which one I want to do.
Yeah.
Yeah. So at that point in time, I was just like, okay lah, why not just try to apply? Yeah.
To all of this.
Yeah, to apply to all. Yeah, but most of the allied health were only available in SIT.
Oh yeah,
like
true.
all the PT, OT, everything was only available in SIT. And NUS only had nursing. Yeah, so I say, okay lah, why not give it a shot?
So you applied both lah.
Yeah, so I applied for both at the same time.
Okay.
Yeah, so I think at that point in time, I wasn't sure which one I want to go into yet. Yeah, so like I sort of like prayed lah. Yeah, prayed and then asked God. I say, God, which one do you want me to go into?
Yeah.
Say, then you just open the door for me. Yeah, so I prayed and asked. Then after that, what happened was only one door was open, which was NUS. Yeah, so my application to SIT wasn't like successful at all. Yeah, I didn't even get like an interview slot. It was just like, thank you for applying. Yeah, you didn't get a chance to for the interview lah.
Yeah.
Yeah, so NUS offered me, and then I just went for it lor.
But is it an interview or what? Or just
it was an interview.
So
I went for interview. So it was like 2 to 3 people, I think. Yeah, they were like lecturers in the school lah.
Okay.
At that point in time, I didn't know lah. Yeah, but now I know. Yeah, so they were like lecturers in the school lah. Yeah, so it was kind of like a very chill interview. Yeah, so they asked like very generic questions. Like, why you choose nursing? Yeah, like why do you want to go into nursing?
Okay.
Yeah, then they asked like, what do your family think of you going to nursing? Yeah, like
That's not very typical.
Yeah, that's not a very typical answer. Yeah. I don't know. I think they just want to maybe filter out. Like, maybe. Yeah, like why you really want to go into nursing. Yeah, so they asked me questions like, why do you choose nursing? Yeah, do you know there's going to be a very tough a job next time? Yeah, so are you prepared for it?
What do you say?
And stuff like that. I say, I don't know, but I think I am lah.
How you say that?
Yeah.
You don't know, but you think,
I think I will be lah. Say I just say like I can adapt to changes very well, or adapt to like new environment very well. So I think I'll be able to lah.
Okay.
Yeah. So yeah lor. Ask me, oh, what do your family think of you joining nursing? Now, especially you're a guy, because not a lot of guys apply to nursing lah. Then I say, yeah, I mean like the stereotype now is like girls. Only there are only girls in nursing, and there's no guys. Yeah, so when I told my family also, or even tell my relative like that I applied for nursing, yeah, their first response was like, you want to 擦人家屁股 that kind of thing. Yeah, so I think they have this like misconception about nursing lah, that it's just like wiping people's ass, you know, that kind of thing, wiping people's butt, you know, that kind of thing. Yeah, so that's the misconception that they have lah. So I say like I think it's more than that lah. It's not just that. Yeah, but I think to the older people, I think that is just their mindset, their conception towards it lor.
Correct.
Yeah.
Anyway, I keep looking at the camera because I need to see whether it's gonna reach 30 minutes, because I want to reach before 30 minutes. I will press.
Okay.
As I'm looking there, now it's 20 minutes.
20 minutes.
Yeah.
Okay.
So I try to look there so that I don't miss out.
Okay.
Yeah.
Can, no problem.
Wow. So how many rounds of interview you went?
Only one.
Oh, one interview.
No, it's only
how
one
long did it
interview.
take to get the results? Like how long did it take?
Within a month. They accepted me.
Quite long actually. 1 month.
Yeah. And I heard they only interviewed poly students.
Oh really?
Yeah. Because like a lot of people who came from JC, they didn't get interviewed.
Why?
Yeah, I don't know. I really don't know.
But do you know the people who? Are you sure? I know about. Do you know about the people who apply? Right? Are they all from diploma nursing, or also from like various backgrounds?
Oh, majority.
Yeah.
Majority were from JC lah. Okay. So they didn't have like any nursing background. Then the others who came from poly, like me, were from other courses.
Oh, not nursing.
Yeah. So I was like from life sciences. There were people from engineering.
Oh.
Mostly from engineering. I think business got a few also. Yeah, they swap lah in a sense. Yeah, that they do. Yeah, then there were also direct intakes, which they were nursing diploma lah.
Okay.
Yeah, then they joined us. Yeah, so they went to year 2 straight long.
Oh, okay, year 2 straight. Then year 1? What did you learn in year 1?
Year one was a lot of the very basic, very foundational stuff lah.
Like what?
Yeah, so they introduce you to nursing, like what are the basic skills you need to have lah, like taking vital signs, like taking blood pressure, taking oxygen level, taking temperature, all the very basic stuff lah, like how to transfer patient from the bed to the chair, how to assist patient. Wait. You know, so there's certain techniques to assist patient one lah. Yeah, so we will learn lah. So then you have to assess the patient first, whether the patient can stand on his own or cannot stand, got strength or don't have strength. You know, yeah, because in the hospital they take patient fall very seriously. Yeah, it's one of like the KPI lah.
Okay.
Yeah, every ward you go to, right, is one of their KPI.
Not to make anyone fall.
Yeah, not to make anyone fall. Like they will have like their targets lah. For example, like 0 fall in this year.
Okay.
Yeah, 0 patient fall this year, 0 medication error this year. You know, so they take it very seriously. Also, in your first year, you learn like how to transfer patient already, because you don't want them to like stand on their own and then they fall. Yeah, like or they don't have strength.
Yeah, and
then you say, okay lah, you can go yourself. You know, that kind of thing. You can go to toilet yourself. You know, yeah. So a lot of in year 1, a lot of assessment and a lot of these like basic skills lor.
Is it a lot hands-on? Like basically a lot of hands-on work lah.
Yeah, a lot of hands-on work. Yeah.
Then
so in school we'll have lab also.
Lab?
Yeah, lab. We have lab classes. Yeah, so you learn all these skills on a dummy lah.
Oh,
basically.
Okay.
Yeah, so a lot of lab classes. Yeah, on dummy and also on your friends lah.
Okay.
Yeah. So all those like blood pressure you can take on your friends lah.
Yeah.
But if all those like injection, all this you cannot do on your friends ma. So you just do on a dummy.
Also, how was the experience from a dummy? Like what's the difference?
Very fake actually. Yeah, it's quite different from when you inject into a real person.
What's the difference? What's the difference? What's the feeling like?
When you inject into a dummy, right?
Yeah,
it's much easier because because of the material lah. It's not as real as a human flesh.
True.
Yeah, so it's very easy, and then you don't have like hesitation because it's a fake.
Yeah,
it's a dummy lah. You just like just go in and then okay lah. Yeah, but when you do on like patient, you know, your hand will shake. You know,
really?
Yeah, like the first time you do, you know, like you scared like what if you hit the blood vessel and that kind of thing. Yeah. So but it's a dummy, you cannot tell ma. You just go inside and then just do it. you know. Yeah, so I think that's the major difference lor.
But for the real person, right, when you do, right, like what was the fear you had? Like, I mean, like, what do you mean by hit the blood pressure?
Blood
vessel. I mean.
blood vessel. Because injection, you're not supposed to inject it into your blood vessel.
How? Oh, okay. I don't even know where's the blood vessel.
Yeah. Like you do injection on your arm, right?
Yeah.
So there's a blood vessel that runs through your arm lah.
Okay.
So you're not supposed to hit the major artery that's in your arm.
Okay.
Yeah, because the vaccine is supposed to go inside your muscle.
Oh, we're talking about vaccine, like
let's say you give vaccine, you're not supposed to the vaccine not supposed to go into your blood vessel. It's supposed to go inside your muscle, then it can be absorbed by your muscle.
Oh, it's to hit your muscle.
Correct.
Then if you're trying to extract blood, you're supposed to hit the blood vessel.
Yeah,
right?
if you extract blood, you have to hit the blood vessel.
Okay.
If not, no blood will come out. Yeah, if your needle is inside your muscle, right, there'll be no blood coming out.
Oh, okay.
Yeah, so these are the things that you have to take note of lah. Yeah, when you're giving vaccination or you're taking blood.
Okay. So, but is it easier to inject here or do here?
For taking blood, is it?
No, I mean like for either you're doing vaccination or you're taking blood.
Vaccination, there's only certain points where you can give vaccination only.
Oh, really? Yeah.
Yeah, only certain points. Like if you're giving muscular, it's only here and your thigh.
Your thigh? Oh, that's why they take steroids here, lah.
Yeah.
Okay,
like people just like because that's your most muscular, so you can just go inside here and just give ma.
Oh.
Yeah, correct. And your arm lor.
Okay.
Yeah. So there's another one that is only can give through skin, subcutaneous.
Like what?
Yeah. So like only can give through like your fat layer. You know, like a lot of people, those diabetes, they have to give like insulin jab.
Yeah.
Yeah. So they go through their belly ma, because that's where your most fats is.
Then what if you have rib? Let's say you are less shredded.
Yeah, I don't think you have diabetes lah. I think the chances of having diabetes is very slim lah.
Oh really?
Yeah, I think so lah.
No, I think about it, like I mean I do see some people in the gym, they all like rib. Like like they really like 4% body fat like that.
Yeah.
So I don't know how they like.
Yeah. I don't think they have diabetes lah. Yeah. Yeah.
But
So
like, diabetes are people who are overweight or like have some.
I mean that's one of the risk factor for diabetes ma.
Okay.
Yeah. So if you're exercising, you're fit, chances of having diabetes is very low lah.
But diabetes can go away on, is it? Like let's say
No.
Cannot. So let's say I become very fat one day, like I got diabetes. Then after I shred down to like 4% body fat. So how do you
once you have diabetes, right? Technically you cannot, because diabetes is not curable.
Okay.
Yeah, it's a chronic illness.
Okay.
So you can only what you call that? You can only maintain it. Yeah, you cannot cure it,
Alright.
but you only can like in a sense subdue it.
Or like suppress it.
Yeah, suppress
okay.
it. Yeah, by giving insulin jabs lor.
But you must take when must you take the insulin jab? How do you
it depends on your dose. It depends on how bad your diabetes is.
Oh, okay.
Yeah. Usually on a daily basis lah, for most people.
Okay.
Yeah, like before your meals you must take.
Oh.
Yeah.
Wow.
So yeah lah. So don't have diabetes. Yeah.
No, hold on. I was saying like if someone is very, very fat, then after they lose all their fat, then they become super ripped, then they still have diabetes. It's like how do they? So you must hit the fat lah.
Yeah, you still can lah. You have to pinch or you just pinch lah. You just pinch whatever that's left there, then you just give it. Yeah.
Wow. Okay. I didn't know diabetes is not curable.
Yeah, it's not curable. A lot of chronic conditions are not curable. So diabetes is one of it.
Okay.
Cholesterol, high cholesterol.
Oh, that's not curable.
That's not curable. And also, that's why you see people taking medication their whole life.
Oh.
Because it's not curable.
Yeah,
I mean, you can exercise, you can do, but you still have it in your blood. Like you won't go
it's like something in your blood.
Yeah.
It's not like it will just disappear.
Correct. Yeah. Like you can just minimize it from having more cholesterol in your blood lah. Yeah. Then also high blood pressure lah. These three lah. Mainly these three.
High blood pressure.
That's why they call it chronic illnesses, because it will never go away. You live with it with your entire life once you have it.
High blood is like when you have stress, is it? Then you have high blood.
High blood pressure, yeah, a lot of things lah. I think a lot, not just stress only lah.
But can stress be one of the factors?
Can. I mean, if you are in really like prolonged stress, or you're stressed like throughout like long periods lah, then probably it can lead to high blood pressure. So
then that will never go away. Oh shit.
Yeah.
I thought you just need to like go to a spa or something like that to relax.
Oh no.
For like 2 months.
Yeah, once you have high blood pressure. But high blood pressure is not really say like once you take one reading, right, and it's high means you have high blood pressure.
Oh
yeah, I think they'll measure it over 1 month.
Okay.
I think if you consistently keep getting high blood pressure, like they measure is high, right? Then they will diagnose you with high blood pressure.
Oh.
Yeah, same for cholesterol, same for diabetes also. It's not just based on one reading, but it's like through a period of time.
Okay.
Yeah.
So year one you learn all these things. You learn all this about all this theoretical stuff, and you learn all the practical stuff.
Correct.
Then when you go to year two, is there any difference?
Year two, that's when they start going more in depth into different things.
Okay.
Yeah, they have like maternal health. You learn about infants, infant health. Then you also start learning about medications. Yeah, so you learn like all the pharmacology, and even more diseases, more complex disease like cancer, heart disease. So every body system they'll go through like what are the common disease each side will have. Like heart is your heart attack, that kind of thing.
Must memorize on everything.
Must memorize for exam. Yeah. But you won't be able to memorize everything
Yeah.
I would say. Yeah, but specific things you have to remember. Yeah.
Yeah, I feel like if you are in the nurse, like in the healthcare sector, right, and then you learn all these drugs and diseases, right, I'm pretty sure you must memorize a lot of things. So how do you go about memorizing all these notes that you have?
Good question. I don't know. I think it's just for me, I learn best by writing notes.
So you write a lot of times?
Yeah, so the notes that they give us, right, it's like very long. So I like to compress it to my own version.
Okay.
Yeah, so I'll just rewrite like their notes again. Yeah, into what I understand best.
Okay.
Yeah, and that helped me to learn better. Yeah, because for them, right, their notes, right, it's really, for example, you see the notes is like Wikipedia. It's like it's just lines and it's just like long sentences, and that didn't really help me. So I just pick out like the keywords, what I needed to know, and just did it into my own notes
but
yeah. So and I try to like separate, like for example, like the heart. So I learn like, so what is how does the heart work? And then I try to link it to like the drugs. I link it to what are the common diseases there is. Yeah. So I learn by body parts
Okay.
And like brain is like the neuro So I just try to link everything together So in order for me to learn better
Okay.
Yeah, because they teach is really all over the place one. Yeah.
What do you mean by they teach all over the place?
They will jump They don't have like a fixed
brain, heart.
Yeah, they don't have. Yeah, they just everything teach. Yeah, so it's up to the individual student Some people can learn like that. Yeah, but for me, I try to make it my own
Yeah, but I imagine like you have five modules right per semester.
Yeah,
so about
4 to 5.
A lot of notes.
Yeah, a lot of notes
So how many months before must you prepare like for your exams?
Usually about 1 month.
So just keep writing notes.
Yeah, just keep writing. Yeah, really just keep writing notes. Yeah.
Oh, cannot man. So after let's say so now after 4 years in nursing, do you like have any regrets now? Like
no way.
No.
I think I don't have any regret. Okay, maybe one regret would be maybe not taking nursing diploma.
Why? Because you see 1 year.
Yeah, I can skip 1 year.
But you never know, right? No one know.
Yeah, I never know Yeah, correct.
Yeah.
And if I go turn back time, I would change what I study in my diploma
Okay.
Yeah.
How do you know that? Okay, because you say that you have, because God opened the door for you, right? So do you think that at the point when you accept nursing, is that point where you know that okay, this is what I'm going to do in my life? Or at which year you feel that okay, maybe this is really what I want to do in my life?
Was okay at the start I didn't know.
Okay.
I didn't know yet. I say, okay, since God opened this door for me, but like why not give it a try? Yeah. So like every semester for us, after we completed our exams, then it's holidays So our every holiday we have to do attachment. So every semester without fail, we'll be sent out to the hospital to do attachments. Yeah. So I think that was because a lot of things you learn theoretically in school.
Yeah.
Like it's just theoretical. So it's only like doing clinicals, all this that you get to practice what you learn. Apply what you learn. Yeah. So I think it was only like at that point in time, like through the different clinicals that I have, like because they'll post you to different areas to give you exposure. Yeah, I think it was only during then that like, actually this is something that I don't mind doing for the rest of my life or for a long period
Okay.
Yeah, for a long period of time. Yeah, was through doing all these clinicals that like, actually I think that it's not bad
Okay.
Yeah, that I foresee myself doing this for a long period of time.
But when they rotate you, it's like you have to go all hospital or like
not to all hospital
Oh, not all.
Yeah, because they will let you choose in a sense. So technically, I'll choose hospital that's nearer to my place, lah.
Yeah.
Right. I mean, I stay in the west. I won't choose like Changi Hospital, right? Yeah, it's like asking for it, lah.
Yeah.
You know? Yeah. So I think first year most of my attachment was in NUH. Yeah, that was nearest to me, lah. Nearest to me. That was before I got bonded. Before I got my scholarship.
Oh. Okay,
yeah, because when I got my scholarship, they will assign you to your hospital already, which is SGH, lah.
Okay.
So after that, I went to SGH all the way.
Oh, so you cannot choose anymore.
Yeah, I cannot choose anymore.
Oh.
Yeah, but they will rotate you around, whereby you get to try different disciplines.
Oh, within SGH.
Within SGH.
Okay.
Yeah, and if you're not bonded, they will still rotate you to different hospitals also. Because there are some students who are not bonded.
So they just go to any other.
Yeah, any other hospitals.
But would they ever throw you to like Changi if you stay in the west?
They say they'll try not to. But if you are, but like, because there are certain slots,
Yeah.
Yeah, so let's say this hospital already like oversubscribed or too many students already, then they have no choice to throw you somewhere else.
But then how you going to travel there? Let's say because your shift start at what? 6 o'clock, 7 o'clock?
Yeah, 7 o'clock. Yeah, so if you
Take
really,
first train,
so if you really live like in Pioneer or Jukun, and you really like get posted to Changi, they will how to say, they will write in like a special requirement, like a consensus for you lah. Say like this student live here, maybe can report 30 minutes later or something like that.
Oh, okay.
Yeah, but I think so far, I never heard like anyone get really like extreme ends lah. Yeah, so far.
Yeah lah.
Yeah, but there are some postings whereby you don't really have a choice.
Yeah.
Yeah, like let's say KK. When we learn about maternal health, that's only women's and children hospital ma.
So everyone had to go there.
Yeah, so most of the students have to go there.
Then where did everyone else go?
Yeah.
You say
so
most.
Changi also have the hospitals that have women's and children's health lah.
Okay.
I think only Changi and KK. Yeah, I'm not sure about the rest. Yeah, but I only heard about these two. Yeah, so if you're not in KK, you're in Changi.
Wow. Okay lah. KK is still nearer than Changi.
Yeah, KK is somewhat still centralized lah, I would say. It's not the extreme end yet. Yeah lor. So yeah, that's only like those periods where you cannot choose lah. Yeah. No choice lah. Yeah.
But when you work when you do your attachment, right, you're doing like shift work also.
Shift work.
So it's like you morning on at night, morning on then night then off then what?
Okay, as a student, they only give you morning and afternoon.
Oh.
Yeah, you're not required to do night yet. Yeah, as a staff then you do night lah. Yeah, so you have to do morning, you have to do afternoon. Yeah, and then and another good thing about student is they don't give you weekends.
Oh yeah, you must do. Oh yeah, true.
Yeah, they don't give you weekends. So they
thing 9 to 5.
Yeah. So yeah lor, morning and afternoon lah. So you have to rotate between these two shifts lah.
Okay.
Yeah.
So it's Monday to Friday lah for students.
Yeah, for students it's Monday to Friday until your last posting, until your last attachment.
Then
which is your final one. Yeah, so that one is a little bit special because they will assign you a nurse in charge. So you follow that nurse like throughout your whole posting. Yeah, so whatever schedule that nurse in charge have, you will follow.
Even in night time.
For the nighttime one, they will give you exposure to do about 1 to 2 nights.
Okay.
Yeah, to just to give you the exposure lah, what will be like next time.
Okay.
Yeah, then other than that, you just follow his or her timing lor. Yeah,
how was it like working?
So if you have to do weekends, then you have to do weekends also.
Oh wow! So basically
basically you're like a full time already lah technically. Yeah.
But how was the night shift like?
Night shift actually quite tiring.
I mean
it's quite tiring because like in a sense, because before that you're working morning and afternoon, so you have to in a sense adjust your body to do night, because night you'll be awake. Okay, the timing for night is about for my one was about 8:30 p.m. to 7:30 a.m.
Oh, 11
so
hours.
it's an 11-hour shift lah. Yeah, so imagine, okay, before that you have like an off day, that kind of thing. But before that before the off day you're working morning, afternoon. Yeah. So you sort of like have to adjust your sleeping timing.
Yeah.
Yeah. If you sleep night, then you wake up in the morning, then you turn all the way until at night, then you turn the whole night again,
Yeah,
that kind of thing.
Correct.
Yeah. So they advise you to like sleep in the morning, then you wake up in the evening, then you go to work.
Okay.
Yeah, but it's easier said than done lah.
Yeah, correct.
Like so you have to turn the whole night to sleep in the morning, and it's tough lor. So at night, actually I like night. Okay. Yeah, because you don't have visitors, so it's just you and the patients. So it's very quiet and stuff like that. But you have things to do also lah. Yeah, and the my experience is if your patients like something happened to your patients, then you have to be very alert.
Okay.
Yeah, because there's reduced manpower at night.
True.
Because the manpower for at night is different from the daytime. You have lesser people. So if your patient like deteriorate or not doing well, then you have to react fast. Yeah. So and then you have to contact the doctor fast. Yeah, because the doctors are not stationed in the ward for at night. Yeah, they're stationed elsewhere because they are on call. They are on call doctors lah. So you have to call them. You have to ask them to, hey, my patient is not doing well. You have to come down now and stuff like that. Yeah. So but other than that, you have to take care of a lot of like nonsensical stuff also lah. Yeah, because a lot of times, right, patients at night, a lot of funny things will happen one.
Okay.
Yeah, like some patients will become like very active at night, like they don't want to sleep.
Okay, but they sleep in the day.
Yeah, they sleep in the day. That's why at night they cannot sleep.
Okay.
Yeah, then at night they will do a lot of pattern, that kind of thing. Yeah, they will like suddenly want to like climb out of bed. They suddenly want to go here, suddenly want to go there. So you have to like take note of their safety also, lor. Take note of these patients. Yeah.
But if you can, let's say they cannot move, right? Then they just press a button to call you, or like they just call you.
Yeah.
Okay.
Every bed will have a button lah.
Okay.
By right, they're supposed to call. Yeah, but some patients are not compliant. Yeah, they just don't want to listen to you, refuse to listen to you. So they'll just get off the bed on their own and stuff like that.
But these are older people lah, right?
Yeah, the older people.
Yeah, because my grandmother is the same. I don't know whether it's some pride issue that older people. She just told because my grandmother now is hospital. Then my mom also always tell me that she always don't call the nurse for help one.
Yeah, she want to do things on her own, right? And stuff like that.
Yeah, which I
I
think it's the old people thing lah.
Yeah.
They just don't want
they
to.
don't want to, maybe they don't want to bother people, or they
Correct.
don't do things on their own. Yeah. But but on our end is we are worried for their safety.
Correct.
What if they come out, they don't know that they got no strength.
Yeah.
And then they just come out and then they fall. Yeah, it's on us, and we have to answer to the family members.
True.
Yeah. Let's say your mom received a call from hospital. Oh, your mother fell on the floor. Yeah. First thing to blame is us already, ma.
Correct.
Yeah. Right. Yeah. So
man.
yeah, very strict lah. There's a lot of rules to follow lah, I would say. Yeah.
So far you only work at NUH and SGH.
NUH, SGH, KK law for
KK.
Yeah. Only these 3 hospitals lah.
Do you feel like any difference between SGH or NUH?
Have.
KK lah, yeah.
I think their culture is very different.
Oh, culture. Okay.
Yeah. And I think the culture between like ward to ward is quite different also.
What do you mean ward to ward?
Yeah, like for example, you go to one ward, you go to another ward. Like the culture between the wards is very different. Yeah.
Like how?
So I went to certain wards which I feel like, actually the culture very good. Like everyone is very bonded, everyone is very close. Then like the sister, which is like the ward manager, also like very good relationship with the nurses and stuff like that. So I feel like in those kind of environment is very enjoyable to work lah. Because like everyone is like, very nice, helping each other. Yeah, but I think there are also certain wards where I've been to is like not very close. So they're like just colleagues only lor.
Oh,
Just there to work.
Hi bye.
Yeah, like hi bye, and they're not very close. And they can be even like, I don't want to help you, I just want to do my own work. So I settle my own work already, I'm done. I don't want to help you.
Okay.
I'm not very helpful colleagues. Yeah, so I think in those kind of environment, it's like you just have to be on your own lah.
Correct.
Yeah, you're just independent lor. If no one help you, then you just die on your own. Just get scolded and stuff like that.
Oh.
Yeah, so I feel ward to ward, culture is very different, and it's very important lor. Yeah, especially if you're new lah.
Okay.
Yeah, if you really throw into like a culture that's not so good, like nobody will help you, then you just die on your own. No? You just have to learn things the hard way.
But can you transfer? Yeah.
Can, but it won't look good on you. If you just, I don't like it here, I transfer out. Then you go to another place, I don't like it here, I transfer out. Yeah, you sort of like a bad record lah.
Yeah.
Yeah, but most of the people I know will work at least tahan lah, 1 to 2 years, then you ask for transfer.
Okay.
So at least it doesn't look that bad.
Yeah lah.
Yeah, then you like, you only work 1 month here, then you want to transfer. Yeah, it doesn't look. Yeah, so a lot of people tahan no, if you don't really like it.
But because now you're going to be bonded to SGH, right?
Yeah.
So that means you're going to be SGH for forever already.
For 4 years lah.
But is it normal for nurses to jump to another hospital? Say without they're not bonded, right? Is it normal for them to like say 1 year I work here, next year I work in?
Usually people won't jump hospital, I would say. They'll jump discipline, or jump to like different ward. Yeah, but jumping across hospital, I think not much.
Okay.
Yeah, not a lot of people will do that. Because like in a sense, like let's say SGH has its own policies, has its own guidelines you have to follow. You go to NUH, it's another guideline, another rule to follow. So you're like relearning the whole thing again.
True.
Yeah, so not a lot of people will jump across hospital lah. Yeah, because like our Singapore healthcare is split into different clusters.
What do you mean?
Okay,
Yeah,
for example, like like the west side of Singapore,
Yeah.
it's called NUHS. Yeah, so under NUHS you have NUH, you have Ng Teng Fong, you have all the polyclinics.
Oh,
So
okay.
there's one cluster.
Okay.
Yeah. Then the central part of Singapore, you have NHG, National Healthcare Group, which
Yeah.
is Tan Tock Seng, Khoo Teck Puat, and the different private hospitals also.
Okay.
Yeah, like Raffles Hospital, all this also all under one cluster.
Okay.
Then for me, it's the East Side cluster, which is Sing Health.
Oh, yeah, East Side cluster.
Yeah, Sing Health is considered East Side cluster.
Sorry, so why are you East Side cluster?
I don't know. They just decided to post me like that. Yeah.
SGH is under East Side
Yeah,
cluster.
it's considered East cluster, but SGH is like the most central
Yeah, exactly.
out of the whole cluster. Yeah, because they have Sengkang Health, they have KK, they have IMH, they have Changi. So it's considered East already.
Okay.
Yeah, but the most central one is SGH lah.
Yeah.
Yeah, so that's one cluster lor. So it's more common for people to move or to transfer within clusters than across clusters. Because it's more headache lah, I think, to transfer within transfer across clusters.
Okay.
Yeah, because within cluster your information, your everything is still within that cluster itself. Yeah, so it's easier for you to apply for transfer, all this.
Oh, I didn't know that we have 3 different clusters. Everyone is just
it used to be 6 then they consolidate into 3.
What was the 6?
I cannot really remember already. Yeah, it was quite a while ago already. Yeah, it was 6. Yeah, then they just changed to 3 lor. Yeah, so it's easier for people to recognize, I think.
But so the system of how it works is all same throughout inside within the cluster lah. Okay.
Yeah.
Oh, so that's why people rather just stay in the same cluster.
Yeah, correct. It's easier lah. It's easier. Yeah.
Okay.
Yeah lor. Unless you really don't like this cluster for some reason. Yeah. Or you move house to the west or something, then maybe it makes sense for you to go to another cluster instead lor.
But is it easy to change? Because let's say you move house. Is it easy to change to, let's say, another?
I think it's easy leh. I think it's easy. Yeah, but it's just that whether you want to like relearn the practice of the hospital, and stuff like that lor. Yeah.
Okay.
Yeah. But usually I never heard of people really changing
Cluster.
Yeah, cluster.
Okay.
Usually they just transfer within like the own cluster. Yeah, like I'm under Sing Health, I'll just transfer within Sing Health.
Do you know if anyone who left nursing like after several years? I'm sure there is lah, but I'm not sure that you know anyone, because I'm not sure anyone who does that. Yeah. Or you have any friends who, let's say, after 4 years in degree, right? They're not going to do nursing. They're just going to like do something else.
I don't know of anyone who came out of nursing already, but I have friends who consider not doing nursing next time.
Oh, okay.
Yeah.
Then what do you want to do?
I have a friend lah. So he's already working now already.
Okay.
In hospital. So he don't want to do nursing for a long time.
Okay.
Yeah. So I think his plan, he wanted to become a air steward.
Oh, okay.
Air steward. Yeah. So with a nursing background, it's actually easier because you already have the first aid qualifications.
True.
So you don't have to do learn all the basic first aid and stuff like that.
True.
Yeah. So his plan for him, the plan is because he's still serving his bond lah. So after he finished his bond to his hospital, then he's thinking of going to become an air steward. Yeah. But with now like the airline industry like that, he said he will see how first lah. Yeah, whether it's worth for him to become an air steward or not.
True. I have a friend who applied for air stewardess. Air steward.
Air steward.
Yeah,
Oh, guy also.
A guy also. Then because he was in the tourism industry.
Oh.
I think now tourism is very bad, right?
Yeah.
But apparently somehow I don't know I forgot when he applied already, but he said he got the first round.
Oh.
First round was like you go to the Changi there to go and do the face-to-face interview. Then one of the questions they asked him was which body part are you most like proud of? Yeah.
Okay.
Then he said, I think it was a kind of a shock question for him lah.
Yeah, like unexpected, right? Unexpected question.
Then he said his biceps.
Wait, is he big or not?
He's a bit plump lah.
Plump.
But he was working out during that period of time.
Oh,
he said, my biceps. Then he talked about his biceps. I'm like, wow, I was laughing. Like,
it's like selling yourself lah.
Yeah,
that kind of thing.
So he talked about his biceps and stuff like that. And then they're like, okay. Then after that, the interview over, right? Then it was quite fast on. So the interviewers will come out. Then they'll say, okay, we select these people. The rest can go back already. Yeah. So my friend didn't got selected lah. Then got this guy he met at the interview. Then he talked to him. Then the guy was just wearing a t-shirt and jeans. When my friend wearing like full suit like that.
Wow.
Yeah, so the guy got through the next round lah.
Uh,
But then he asked the guy like, "What do you say about for that question?" The guy say, "Oh, I see my." He said that he liked his veins. His like his veins on his hands. Then he talk about his veins. Then he got through. Yeah, round 2. Yeah, and he never even dress up. He just wore like a
t-shirt and jeans only.
yeah. So I think appearance really matter. I think they really care about your appearance.
Yeah, a lot of appearance.
Correct. Yeah, but wow, I was like, so my friend didn't get through that. Okay, lah, that's it.
You tried this year? Or
I forgot when was it. I know it was like very recent because I think it was really either last year, maybe before the whole situation happened.
oh
Yeah,
okay,
last year or maybe like early last year lah. Early last year, I remember, because he graduated last year. I think I'm not wrong. Yeah, but that was like I didn't know they were asking some question one like so.
Yeah,
what a weird question to ask.
yeah, basically you have to sell yourself lah.
Yeah, but is it possible for nursing to? I mean, your friend say you want to do it, become air steward, right? But are there other people who want to do other things? No.
I have friends who say like they don't want to continue nursing for long, but they really haven't decided what they want to do after that.
Oh, okay. But
I know someone who also like just take this degree just for the sake of taking.
So what do we do after that?
But she's doing like some I think insurance agent or something like that.
Financial planner.
Yeah, that kind of thing lah. Yeah, financial something lah. So during like our study, she was really studying business stuff already lah.
Oh.
Yeah, on her own outside. Yeah, so she's not planning to do nursing already. Then she said, "Oh, yeah, just taking for the paper only."
Oh, that's
yeah.
normal.
So like next time if I fail in my business, I still got something to go back to.
Yeah, really can go back? Right?
Yeah, because you already have this degree ma. So technically, any point of time you can go back to nursing.
Oh, really?
Yeah, really.
Even let's say
it's just that your license, you have to renew your license. So
what do you do to renew your license?
You can renew. Then you just go for like they'll send you for training, refresh your skills and stuff like that. So yeah, quite simple lah.
So how long is this training normally?
Yeah, I'm not so sure leh.
Not sure.
Yeah,
okay.
Not very sure. Yeah,
wow.
But because you have this cert, yeah, you can go back to nursing anytime.
True.
So I think that's why a lot of people take.
Yeah. Oh wow, but I do insurance. I think everyone is doing that now.
Huh?
Yeah, I feel like a lot of people are doing that now.
I know someone also. She was the first nursing student to take nursing and major in econs.
Huh? Wait, what do you mean by
I think minor. I think minor or
minor.
I think minor.
Okay.
I think minor in econs. So she was. I think she was the first nursing student to do that. Yeah. At first, when she tried to ask, I mean, I hear from my friend
yeah,
like she tried to ask for approval because you need to ask for approval to do a minor. In this because it's not common for a nursing student to do a minor.
Yeah, correct.
Yeah. So like they were strongly discouraging her to not to do it.
Strongly.
Yeah, discouraging because like the nursing schedule like a bit different also from the normal curriculum.
Correct.
Yeah, so they were like, oh, you think you can cope and stuff like that.
Yeah, they say that.
Yeah.
think you can
so,
cope.
yeah, basically, I mean, she just worried for her.
Oh yeah.
Like whether you
understand.
can cope. You still have to take separate exams and stuff like that.
Yeah.
Yeah. Then she say, she can. Yeah, so she did it lah, and I think she really, have a minor in econs. Yeah, so she was the first nursing student to do that.
But it's not normal to do like that other minors or majors.
Yeah, it's not.
Wow.
Yeah.
That's so weird though.
It's not.
And you just keep pushing to people to take minors, to take this, but then for nursing they don't.
Yeah.
They don't let you do
exactly. It. Yeah. So I think it's not common law. Yeah, they just want you to focus on nursing solely.
Okay.
Yeah.
During your curriculum, right? Actually, I want to ask this. Yeah, during your curriculum, do you work with the people who are in like medicine? Or how do you have modules that are similar to them?
Oh, there was only one module which we had to work with them. I think it was in year 1 or year 2. I can't really remember.
Oh.
Yeah, so it was this like they call it interprofessional education.
Okay.
Yeah, so it's like a project in one of the modules where we have to work with nurses, doctors, and pharmacists.
Yeah.
Yeah, so...
Oh yeah, pharmacists.
Yeah, pharmacy also. Yeah, pharmacy also. Yeah, so it was this like interprofessional thing. So they gave us like this case study.
Okay.
That we have to read lah. So they will separate us into groups. So your group will have at least one nurse, one doctor, and one pharmacist. Yeah, then we had to discuss on the case. Then it was not a very straightforward kind of case lah. So we read the case and then we had to discuss and then we give answer to the lecturer lor. Yeah, but I can't remember what case was it specifically lah.
Okay.
Yeah, but basically everyone had a sort of like a role to play.
But
yeah, so we have to discuss.
Case,
yeah, all the groups will have the same case. So 1 week will have one case, then the next week will have another case.
It's a module lah.
Yeah, it's a module.
So it's like 12 weeks.
No, it's a subset. It's just one project in a module. Yeah, so it lasted for like maybe 3 to 4 weeks, if I remember correctly. Yeah.
But so strange. How come you all don't take the same modules? Like I assume that the people who are going to be doctors will have almost the same, some of the same course, same mods as the people who are going to be nurses.
Mm.
Yeah. There's only one. You told me only one module.
Yeah. So in terms of module, okay, for them, right? I think for medicine students, right, their modules are more theoretical.
Yeah.
Yeah, and even more in depth than us.
Okay.
Yeah. So for them, let's say, for example, they have to memorize all the bones in the body.
Oh, but you
we don't have. We know the major ones, like the common ones. Yeah, but for them, they really have to know from head to toe, like everything. Yeah, because it helps them to diagnose ma.
Okay.
Yeah, so for them in order to diagnose like patients, they have to know head to toe.
Okay.
Yeah, because for us, we don't really need to know how to diagnose patients. So we don't really need to know very in depth, but we need to know what are the common ones lah.
Okay.
Yeah. So we don't take our lessons together lor. Yeah, it's a separate one.
But then I can understand why lah. Cause we all don't learn the in depth, but then they all learn the more in depth. But then the practical part is where you guys learn more than them lah.
Correct.
Okay.
Yeah. Because I think I heard from like the year one, the medicine year one, like their year one is solely all theoretical.
It's all books
it's just all theory for year 1 and year 2 at least. Yeah.
Wow, 2 years of just theory. Wow.
Yeah, it's really
that's 5 years, right?
Yeah, that is 5 years. Yeah.
Do you all follow the same structure as them? Like after that, they become a resident or something like that?
No. Their structure is much more complicated.
Yeah, I'm so quite confused.
Yeah. Their structure is much more complicated.
Okay.
Yeah.
But for
us, as long as we graduate, we apply for license, we can start work straight away already. So, we still have to go through probation and stuff like that. But we don't really like, for them, they have residency for like 1 to 2 years. Then they can become like a full-fledged doctor. Yeah. But for us, we go through probation. Once we finish probation, we are on our own already.
Okay. But what's progression like for a nurse? Like you junior nurse and what senior nurse or what?
After you come out to work, you automatically become staff nurse.
Okay.
We call it staff nurse lah. Yeah. So within staff nurse, there's like staff nurse 1, there's staff nurse 2.
So I guess 2 is the more special, like higher rank.
No, 1 is the higher one. So you start with 2. Yeah, if you have diploma, you start with 2. If you have a degree, you start off with 1.
Oh, okay.
Yeah, so you jump 1 rank lah, technically.
But the 1 rank, is it how big of a difference is it?
It's not much difference. Yeah. Yeah, it's not much difference. Yeah, I think if you from staff nurse 2 to 1, I think maybe 1 to 2 years. You work 1 to 2 years, you can jump from 2 to 1.
But then you did a degree of 4 years. Then why would I do a degree? Might as well just go to diploma, then straight away 2 to 1.
Yeah, okay, because after that, after staff nurse, you become senior staff nurse. Okay. After senior staff nurse, you want to progress further, you need a degree.
What's after senior staff nurse?
After senior staff nurse, you become assistant nurse clinician.
Which is what? Sorry, I don't know.
They call it, short form is ANC lah. ANC. Yeah, they call it assistant nurse clinician. Assistant nurse clinician. Yeah, ANC. So basically you have a wider job scope than senior staff nurse. So if you have diploma, you stop at senior staff nurse.
Okay.
By your degree, you can progress further. Yeah.
But do you know what the assistant clinical
assistant nurse clinician?
You know what's the difference between that?
Yeah. So assistant nurse clinician, right? After that, you become a nurse clinician. So when you become a nurse clinician, technically you learn how to run your own clinics.
Oh, okay.
Yeah.
Right,
so there are some hospitals which they have clinics that are run by nurses law. Yeah. So you have a more higher job scope, I think, wider job scope. Yeah. Than staying in the work. Yeah. So if you choose to progress higher, you have more job scope law. A wider range of job scope to do. Yeah.
But what level do you have to be part of the surgery? The surgery you see nurses inside, right? So at what stage will you be able to do that?
Oh, you can.
Should we start?
Yeah, can straight start already.
So you have been to
operating theatre? Yeah. I've been to.
How is it? I mean, like, I won't ask you in detail what is it about, but I'll ask you what's your feeling or experience.
Experience.
When you see all those blood everywhere and everything.
Quite. Actually, it's not as serious as I thought it would be.
What do you
Yeah,
mean by
because
not
like
serious?
it depends on the doctor's like what is his style. Yeah,
Okay.
because like the surgeon lah, what is his style? Yeah, some surgeons are quite serious when it comes to surgery. So some operating theatre, right, the mood very serious because the lead surgeon also very serious one.
Okay.
Yeah, but some there are operations that I've been to, right, like they'll play music.
Okay.
Yeah, so like the lead surgeon is like more chill. Yeah, then while he's operating, he'll sing song one some more. He'll like hum to the song.
I think he relax himself.
Yeah, like more relaxed. Yeah, then can still talk to other people lah. Say, hey, yesterday the news I got read that kind of thing. Yeah, more chill, but some are more serious lah.
Okay.
Yeah, so I think it really depends on the mood. Really depends on like the surgeons lor.
But what was your role there when you were there?
Okay, nurses in operating theatres, right?
Yeah.
You have to be very familiar with the equipments.
Okay.
Yeah, all the operating equipments. Yeah, so they are like your bread and butter.
Oh.
Yeah, you don't know them, you fail.
Okay.
Yeah, so because the surgeons will require that from you. Once they say something, you must pass them something. Once they say something, you must give it to them.
Okay.
Yeah, if not, yeah, because I've seen before like the nurse cannot scolded because they passed the wrong thing. Yeah, I think
practical test is it? Practical test.
No,
in
like doing
school.
my attachment.
Oh.
Yeah, and I think the nurse that I followed was sort of like new. I think like not the senior lah. So I think she passed wrongly. Then the surgeon like, hey, what are you doing? Why you pass me this? That kind of thing. You don't know me? Yeah. So like you're kind of scolded. Yeah. So you must really know your equipment.
Okay.
Yeah. So you must be really you must be fast also lah. Once the surgeon asks, you must pass already.
Okay.
Yeah, and stuff like that.
Have you seen how they do it? Like when they cut the person.
Yeah. I seen.
Was he like was it like steady hands? I always say steady hands, right?
Yeah. They're quite steady. Yeah.
Wow.
They don't really shake one because they drawn lines already ma. They use markers to mark out where they want to cut and stuff.
Oh, when you're sleeping, you draw lines on you. Oh.
Yeah, like before you have an operation, before you go through operation, right? The surgeon usually will go and find you first, then they'll mark out the site that they want to operate on to let you know also lah that I'm going to cut this part, I'm going to cut this part. Yeah, so they'll mark out. So when you put under anesthesia, then they remove your clothes. They'll see the marking already, so they just go according to it.
How fast does the anesthesia normally?
Oh, very fast. I think within 1 minute, knockout already.
1 minute.
Yeah.
That's quite long though, 1 minute.
Yeah, within 1 minute usually already. Yeah, they will inject into the blood lah.
Oh, not like that one.
Got some is also inhale one.
Okay.
Yeah.
Wow. Then before you go into the surgical theatre, is it correct? You must do all the
must scrub your hands and must really wash lah.
How long though must you wash to get rid of everything? I feel like now COVID, we think of all the washing thing, right? How effective is that, man? I see other people doing surgery, they all do all the way until the hand here.
Yeah. You have to do until your elbow.
Oh.
Yeah.
But why the elbow though? Do they really go that deep? Like,
I mean, it's really just to prevent like if let's say you have any bacteria from like moving downstream to your hands lah.
Oh, you can do that one lah.
Yeah.
Oh, do you know?
Yeah.
Oh.
So that's why they have to like really wash until your elbow lor. And then they like that, so that the water don't drip back to your fingers or any bacteria don't drip back to your fingers.
So it must like that?
Yeah, must like that.
Oh.
Yeah.
Oh.
Yeah, so a lot of cleanliness a lot of hygiene steps to follow in our painting theatre.
But I don't know if I can ask you this, but was there a lot of blood? I can ask you this, right?
Can. Actually not a lot.
Not a lot of blood.
Yeah. Because once they cut, right, they'll suck the blood already. Like they'll put the tube inside.
Oh.
Yeah.
Okay. I thought the blood just... Oh.
Yeah, won't. Yeah.
So they put the tube in, then they got the blood.
Yeah.
Then they'll pull back the blood again or what?
No, because you're when you're going through operation, right, you'll be running blood transfusion continuously.
Also, it's like in, out.
Yeah, in, out, yeah.
So whatever blood take out, you just thrown away.
Correct.
Oh, wow, dude. So you actually...
Yeah, so there's a lot of blood that's being used when you go through operation.
Oh,
yeah.
My friend went at the blood donation. Then he told me that they always
blood bank
need... Yeah, blood bank. So they always need like blood. Especially last year, they say like it was running low on some... I don't know which one was it. Then he asked me whether I want to do it. I said, now a COVID period, how to do it. But I think I'll do it soon. Have you donated blood?
Not really. Because I told myself, my blood not very precious.
What do you mean?
Yeah, because, okay, I mean, if you donate blood, if you're old, I mean, your blood is very precious lah. If you're O plus, because you're universal ma. Any blood type you can take. Yeah, because my blood type is AB plus.
This is a rare one.
Yeah, it's the rarer one. So if I donate my AB plus type, right, only AB plus can receive.
Yeah, all the more is more precious, right?
Huh?
All the more is more.
But as an AB plus, I can take from any blood type.
Oh, wait.
Yeah, I can take from O, I can take from A, I can take from B, I can take from AB.
But then, what so
but if I give my blood,
you can give it AB plus.
yeah, I only can give AB plus. But I can take from anyone. Yeah, so so it's like a bit. I tell myself it's a bit worthless because I can take from anyone.
True.
Yeah, but if you're O, of course you better donate lah, because you can give to anyone.
Is it O plus and O minus? Is it?
Yeah, O plus and O minus.
Is there a rarity also? No, right? They're both the same, is it?
Yeah, if you're O minus, I think you cannot donate. I think you cannot donate blood. O minus.
Oh.
Yeah.
Actually, do you know I don't even know what's my blood type.
Oh, you don't know
I thought they give it an IC, but then they never say.
Oh,
so
never mind lah. When you go and donate, you'll know lah.
Maybe lah. I still waiting for the day. I just afraid of the putting a needle in.
Some of the needle they use is quite big.
Yeah.
It's bigger in size because over a period of time.
Yeah. Because actually I did one experiment before in NUS. It's some food one.
Oh, I also did before.
Oh, you did as well?
Yeah. Yeah.
They don't put that thing inside you, right?
Yeah.
Then no food for don't eat anything. You just fast in the morning or something like that.
Yeah.
Then you go
I think I did. Oh, I did. Yeah, I did before.
Yeah. How?
I think I did twice.
Yeah, so
two different ones.
Quite a lot of money you give.
Yeah.
Like what? 400, 500?
Yeah, correct. Yeah. I think the latest one I did was only like NTUC vouchers.
Huh? Now they give NTUC voucher?
Yeah, the NTUC one.
It's the A-star one, right?
Yeah, the A-star one. $300 NTUC voucher.
Why would you give NTUC voucher?
Yeah.
I'd rather have the
I rather catch But I mean, at that point of time, that was like the most attractive one. I was just like, okay lah, just do lah.
What was the experiment about?
Huh?
What was that one about?
They were testing some glucose thing in your blood.
Must you bring back home the bottles? They still bring home bottle.
No. They asked me to eat some those what's that, frozen food.
Frozen food?
Yeah, frozen food. Like those the 7-Eleven one, you heat up.
Oh, those kind of food.
Yeah, those kind of food. Yeah, so they give me that, one packet of Milo and one what's that? Energy bar. So that was like my standard dinner.
Dinner?
Yeah, dinner.
Wait, so you eat it every day?
Yeah. So I have to eat it once per week.
Oh, once per week?
Once a week. Like, so let's say my blood test is on Thursday. I have to eat it on like Wednesday night.
Oh,
then
night before.
Yeah, then that's the only meal. That must be the last meal I eat.
Okay.
Then until the morning, I cannot eat anything. Then I go for my blood test.
Then what do you do there?
Yeah. Then after that, the blood test, then I have to stay there for 3 hours.
Oh, then
then in between, they ask me to eat like fruits.
Oh, can
bread,
eat also?
Yeah, I can eat bread and fruits or something like that. Yeah, then they will continually take a blood law.
Oh, then you do anything you want, right?
Yeah, I can do anything I want. Yeah.
I think that was one of the free money that they give lah.
Yeah.
Just that you need to spend like maybe 3 to 4 hours there lah.
Yeah. That was a better one. I think there was one I did also is the sleeping one. You got to do
the
before?
sleeping one? I never do.
The one I have to go to Duke NUS and
sleep over.
SGH, yeah, sleep over one night. Yeah.
Oh, what do you have to do though? What did they do?
They have to put the leads on your head, to measure your brainwave one. Yeah, so I have to wear that to sleep.
Is it uncomfortable?
Yeah, a bit. It's like a hair netting kind of thing. Yeah, it's like a hair net lor. Then you can feel like the wires on your head.
Okay.
Yeah, then go to sleep. Then in the morning when I wake up, I have to do some computer tasks.
Oh.
Yeah, some computer tasks.
That's it.
Yeah, that's it. But before that, I have to sleep on a regular. I have to stick to a fixed schedule, sleeping schedule.
Oh, means like a fixed amount of hours you sleep. Oh, okay.
Yeah, so if I say, I want to sleep 12 to 8, so I only can sleep at that period of time. Then they'll give you a tracker to track.
Oh yeah. I saw it on before. They say, but some of them they say sometimes you must do 6 hours or 4 or 5 hours.
Yeah.
Yeah, so that they test out different people with like different amounts.
Yeah, correct.
Oh,
yeah.
but you got 8 hours.
Yeah.
Okay lah.
I think I was 7. I think 7 hours. Yeah, which is not too bad lah. Not too bad.
Yeah, imagine you got the 4 hours and it's like
yeah. GG. Yeah, that was quite interesting. Quite interesting.
How much you get for that?
I think 400-500 also.
Wow, one night only.
Yeah, not bad.
Yeah lor.
It still force you to sleep regularly, which is good.
Wow, $400.
Mm.
But they do NUS lah. Okay.
Yeah.
Oh, but I don't think I can do that. How? Were they watching you sleep?
Yeah.
How they watch you sleep?
So beside it was a room.
Yeah.
Then there's a glass panel, so you cannot see them, but they can see you.
That's so weird, dude. That's so weird.
Yeah.
I cannot sleep like that. How to sleep if someone's staring at you?
Okay, but they're not staring at you. They're staring at the monitor, which measures your brainwave activity.
But you cannot see them, right?
Yeah, you cannot see them lah.
But you never know if they're staring.
Yeah, that's why. Yeah.
What? But it was in the dark room lah.
Like when you sleep at night, they off the light. You cannot see anything already.
Oh.
Yeah.
Okay. Wow. Yeah. Luckily I never do that.
Yeah.
I was thinking of doing that because I was thinking maybe you can do that because quite good money also. But then I was like,
I think at one time it was one of the higher paying one already.
Yeah, but I think stay over. I was like,
Yeah.
It's okay
I just
lah.
try lor. I just okay lah, why not? Let's try.
But you did this in when? Year 3 year 4?
I think year 2 Year 2
year
year
2.
2. Yeah.
Okay.
Quite a while ago already.
Oh.
Yeah. The food one was quite recent, I think, last year.
Oh, but that one was that's more fun lah. That one.
The food.
Yeah.
Get to eat something, right?
Yeah. But one time they just give me like some glucose water.
Oh.
Just drink that and they say, okay, we're gonna measure your blood every few hours.
Oh, you drink before the blood test start.
Yeah, so we drink that, then wow, very hungry after that, yeah. Because like imagine like 6
Cannot eat, right?
4 hours just
glucose water.
Then got one is they don't even use the tube one, they use the prick one.
Oh.
Yeah, that's quite painful Because
Oh.
the first 3 times is fine lah, because it's like a prick only, right? But then when you do like
Multiple
10
times,
yeah. It's like, especially on the same finger, like 2 fingers, only these 2 It's like
okay.
Yeah.
Oh, that one will prick lah. Okay.
yeah, I got the prick one and I got the whatever this intra something. Oh, dude. I cannot, man.
For the money lah, no choice. Students are broke no choice.
But have you done that? Because you say you done injection, right? Like for this. But have you done the intra
yeah, we have. But as students, technically we're not supposed to do it yet lah. Until we are full-time nurses.
But there's a difference man to do that and use the normal injection needle. In terms of that's the size lah, but in terms of the technique.
Technique wise, not much difference.
Then why would they not allow students to do that?
Yeah, I don't know I mean, as a student, you're very protected. Yeah,
True,
there's a lot of things that you cannot do actually.
Okay.
Yeah, a lot of things related to like, I mean, injections we can do.
Yeah.
Blood taking we cannot do. Giving medications, only oral one we can give. We cannot give those liquid one. Yeah, we cannot give those high risk one.
But why? I mean, I understand about high risk, but why they can't give liquid one? Like cough syrup is liquid, right?
Oh, I mean, cough syrup can. Like, I mean, those that go through your.
You mean
that go through like IV lah, like
IV.
intravenous.
Okay,
yeah,
okay,
those
okay.
intravenous we cannot give.
Okay.
Yeah. So as students, still quite protected lor. They scared. Yeah, things will happen. Yeah, because IV is the fastest route ma.
Yeah, correct.
Yeah, it's the most effective one. So if you really give wrong medication, GG already lor.
True.
Yeah.
I heard there's a pH in your blood also, right? You must give the right pH level or something like that.
In your blood?
Is it your blood or is it like in your body there's a correct pH? Then if you give you put in the wrong pH of blood or water or something like that you will cause some. I don't know whether this is true or not. Yeah,
I mean, in every human body there is a acid-base balance lah.
Yeah.
Yeah, you cannot, your blood cannot be too acidic or too basic.
Yeah.
Yeah. So if it's too acidic or too basic, you have to give those kind of medication to maintain it.
Oh, okay.
Yeah.
So when you're going to start work basically in like 2 months. Your role would just be like a staff nurse, right? You say
staff nurse.
Then will you do any specialization to any specific?
Oh yeah. Usually they will send you for specialization one after you work for a period of time.
Oh.
Yeah, they'll send you to do like advanced diploma.
Advanced diploma.
There's something called advanced diploma. So you be specialized in the area that you're in. So for example, if you are in surgical ward, then they will ask you to do advanced diploma in medical surgical skills.
Oh.
So you learn more in depth lah about the surgical stuff. Yeah. So you specialize in it lor.
Then because we know someone who is in the healthcare industry lah. She's doing what radiology.
Yeah.
Is it? So that's also considered as a specialization.
Yeah. I mean that's more towards allied health lah.
What's that?
Anything that is not nurse and doctor is called allied health.
Oh, okay.
Yeah, allied health. So like your physiotherapist, your occupational therapist, your speech therapist, your dietitian,
not really.
Yeah, radiologist. All this is all under allied health.
Allied health. Okay. So where do you plan to specialize in, like as a nurse? What's your plans?
Okay. So far, because I will be starting work in a cancer ward.
Oh, what did you tell you already?
I'll be dealing with cancer patients lor.
Okay.
So I think most likely I'll specialize in oncology lah, which is cancer lah.
You cannot choose.
At that point of time they gave me a few choices. So that was one of my choices lor. And then I got it.
Why do you choose cancer?
Yeah. I thought it was quite interesting leh. Yeah, to learn more about like cancer and the different diseases and stuff like that.
What are the other choices that you thought of also? Or they gave you?
I wanted to do ED.
What's ED?
Emergency department.
Oh, like those.
Yeah,
those,
the A&E one.
Yeah, A&E, yeah.
A&E one. Yeah. There was one I wanted to do. Yeah. Quite interesting lah. Like a lot of adrenaline and very fast paced.
But it seemed like quite stressful.
Huh? Yeah, it is. It is.
Yeah.
It is. Yeah. So to me it was quite interesting lah. Yeah, because I had my posting there also.
Okay.
Yeah, we did 2 weeks in A&E also. Yeah, so really very fast paced.
But you like it
Yeah.
Like
really like no time to think one. Must really just keep doing.
Then why did you want to choose that? Because you say they did give you the choice, right? Of A&E.
No, they asked you to rank your choices though.
So you went to the first choice.
Yeah, I didn't get it.
Oh,
yeah.
The second choice is cancer. Oh, okay. Well, I didn't know that A&E was so popular.
Yeah, I think quite a lot of people want to do, especially guys, I think, in nursing.
Why though? Just because it's like...
Yeah, I don't know. It's just very
small.
Yeah, it's just very fast paced. I think a lot of people like it.
But you're not the person driving in the ambulance, right?
Oh no.
You're the person who when the patient comes, then you
correct
execute.
Yeah.
Right? Okay. Oh, okay.
Yeah.
What about cancer patients? Man?
Yeah,
that'll be hard. That'll be tough, man. Because cancer is incurable, also, right?
Yeah. I mean, I had a few postings in cancer ward already.
How was it?
Yeah. Initially quite hard to cope because
how to cope in terms of what? Emotional or what? Or...
I mean, in terms of theoretical also, because some of the cancer names quite cheap.
Like what? What's really, the cheap one? Give me the cheap one. Give me a cheap one.
Huh? No, because in cancer, right, they classify to a lot of things.
Yeah.
Yeah. So different cancer, you have like carcinomas, you have lymphomas. So you have a lot of things. Yeah. So different cancers, like start from different places. Okay. Then they will say, oh, this one start from here, this one start from that. Yeah. So and then the different staging also, stage 1, stage 2, stage 3. Yeah. Whether it's localized, whether it's has it spread to other parts of the body. You know. So all these things, a lot of the theory lah. Yeah. So like, at the time I was quite lost. Yeah. So I had to go and read up on myself. Yeah. Go and research like, oh, what is this disease?
Okay.
Yeah. And then medication wise also, a lot of cancer drugs. The names are really very hard to remember one. Yeah, so I think for them they really go through like a course.
Okay.
Yeah, to learn about the drugs. Yeah. So it was quite in a sense a steep learning curve lah. At that point in time to learn all this. Yeah, and then dealing with cancer patients also not easy lah. Like you say, like the emotional one.
Yeah.
Yeah. So occasionally we have like young patients.
Oh, like very, very young people.
Yeah, young patients. Yeah, and then you see they have like stage 3, stage 4 cancer.
Oh, but actually, how does this happen when such so young people? I'm not sure whether you know.
Some could be genetics or family history of cancer.
Oh.
So these young, so it's passed down lah. Yeah, it's passed through genetics. They have or some of them really it's just life.
Yeah, cancer they say cancer just hits you.
It just hits you. I really don't know. Yeah, you could be fine one day and then the next day you go and test. We got cancer.
Yeah,
you know, that kind of thing, and it progresses very fast. That's the thing. Yeah. It progresses very fast.
Do you know when do they call it stage 1? When do they call it stage 2?
Oh, the one you have to go for testing, no? You have to go for biopsy.
Oh. But do you know at what stage you know? I mean, at what point you know that it's stage 2 or stage 1? Oh,
it depends on whether the cancer is localized or is it spread to other parts of the body. Because usually if it's localized, means like let's say you have colon cancer.
Yeah.
Okay. So if they test and the cancer cells are still within your colon, it's still within the area, usually it's stage 1 or 2. Yeah.
Okay.
But if you have spread to let's say your stomach, spread to your liver, your lungs, usually it's stage 3, stage 4 already. Yeah. It's really widespreading already. Okay. Yeah. So that's how they stage it lah.
Oh. Wow. Because I've genetic wise actually I don't want to understand. Because my father's step uncle. Yeah. Step uncle, I think so. I'm not sure. But his family tree is like all cancer one. Yeah. So it's like because my grandfather has 2, my great grandfather has 2 wives. Then one of the wife is the other side one is like all stricken with cancer one. Yeah. So it's like you can see man, like they just die quite early one.
Yeah.
So
Yeah, so that's why they always
Yeah.
advise if you have a strong family history of cancer, you go and check it out early.
But what can
Yeah.
you do? Yeah.
Just do testing lor. Like those cancer that can be that can test one, you go and do lor.
But also you probably won't have kids also, right?
Uh,
Because you probably pass on them and then
I mean,
quite hard for this
yeah,
people,
yeah,
right?
yeah, quite hard lah.
Yeah.
But I think they will still want to have kids lor, and really hope that they don't have it lah.
Yeah.
Yeah.
But that's difficult lah.
Yeah, difficult.
Yeah, man.
Yeah.
Wow.
Yeah, so the emotional wise, yeah lor. Yeah, it's tough lah when you see like young patients, especially lah. I mean, older
Definitely
one
lah.
like, I mean, it's still sad lah, but like the younger ones are the one that really like hit you.
Yeah, man, because they're so young, they like haven't even lived their life yet. And
Yeah.
it's like
Correct. And then,
Almost see
and then like
anything.
you speak to their family, you can see like very sad lor.
Okay.
It's just a very sad thing. Yeah.
But as a nurse, you must you be the one who talk to the people or like doctor are the one who do it?
Both lah.
Oh,
Yeah, usually you will have instances whereby it's doctor, sometimes it's you also.
okay.
Yeah, because sometimes the family will approach you first and ask for updates and stuff like that lah. Yeah, so sometimes you just have to speak to them lah. If the doctor is not here, you have to speak to them lor.
Okay.
Yeah, and also in cancer wards, you have to deal a lot with death lor. Very common.
Yeah.
Very common. Yeah, to deal with death. Yeah.
Then is there like a therapy session for nurses themselves or like for doctors? Because you guys will see so much death that I mean you'll probably have to.
Yeah. Actually, they have like hot helplines. I think if you're like
Helplines?
if you're like you're feeling very emotional, yeah, it's part of like their welfare kind of thing lah.
Oh.
If you are going through like emotional distress,
Yeah.
there's actually this like hotline you can go to, yeah, for like counseling and stuff like that.
I mean, I'm not surprised. I imagine you see like wow, like every week you see someone. Like,
Yeah.
That's quite extreme.
Yeah.
Yeah. Cause even my NS, right, I mean, not say recently, but like a few during my time I was there lah. Then there's this person who apparently shot himself with the gun.
Oh.
Yeah, in the bunk with all his friends there.
Wow.
Yeah, and like they just finished like their rotation, their shift. Then they come back to the bunk at like 7 a.m. Then he just went to the bunk and they all sleeping. Then he just sit down on the floor. Then he just shot himself.
Wow.
Yeah. Then that's all emotional counseling. They tell everyone like, okay, there's this counseling session for everyone, who's in the camp, anyone who need to go. But yeah, that was quite extreme. Because imagine I remember our NS medic, he had to run down and go help. But then, like, it's like he's just an NS guy only.
That's why.
Yeah, so it's like
I think you also don't know what to do. Yeah.
and quite extreme. Like, wow, you saw. I mean, like nobody expects something to happen.
Yeah. Correct.
And I wasn't there because it was very early in the morning, like 7 a.m. But when I came at 8:30, it was like there was this like police tape there and everything. Yeah, but I heard it was because the guy got some girlfriend problem. Yeah, then
he took his own life.
Yeah, so that's why for now on they say we ban bringing armed weapons into the bunk.
Oh.
Yeah.
Last time can
Last time they allow, because last time, I mean, they just quite carefree one lah. Like just carefree and then everyone.
But they let you bring loaded one.
Yeah, because they just came back from their shift. So they just want to rest.
Oh,
yeah. So because
okay.
usually the armory not open yet. They only open at let's say 8:30. But they came back at 7 o'clock. So they nothing to do, right?
Oh, so just go back to bunk first.
Yeah, and then the guy. I think now they changed the policy. They say once you come back at 7 o'clock, they will open armory already. So you immediately
return arms.
Yeah. So that was
it's quite scary actually.
Yeah.
It's quite scary. Imagine you bring to bunk and you go on a rampage. You
Yeah,
just
exactly.
Like, you shoot anyone, right?
Exactly.
Yeah, you never know.
Yeah,
it's quite scary.
But just that, I guess in any like, army or police, they all just assume everyone is just sane.
Yeah.
No one,
everyone is normal.
everyone
Everyone is normal.
Nobody will do it. Since because the past 20 years no one do it, so I guess nobody will do it. Yeah. Then I mean it's sad lah, but that's how it is, man. Yeah.
But do you know the person who?
I don't know.
You don't know.
I don't know. I don't know whether I got train the guy. Cause we had to train. Cause these are the new batch of Cause our camp kind of have a new task force. So they hire a lot of, they kind of like bring a lot of NSF. So we had to train them as trainers. We train them, but I'm not sure. I never get close to any of them. I was more of the just don't really care one. Just do my job and go home kind of thing. Yeah. So I didn't know any one of them. Yeah.
Okay.
Yeah, man. Wow, we've been doing this for almost 1.5 hours.
Oh,
we just stopped all
quite long way.
Yeah. Yeah, you can see 1 hour 20 minutes.
Oh. On average, how long is your podcast?
Around here 1 hour 30 minutes, but then there's
minutes.
some that do 3 hours.
3 hours?
Yeah.
Like continuously.
Yeah. Like 2.5. 2.5 lah. Because you went toilet, then you come back. Yeah. Some like 2 hours, some 2.5. Yeah. I give the people the amount of time to speak. Yeah. Yeah. Because some people tell me to cut it down to 30 minutes. But then I say
30 minutes a bit too short.
Yeah. I'll say it's too short.
Yeah. Unless your answers are really direct. Or your questions are very direct.
And I feel it's like very disrespectful to the person. Like I just come here with a list of questions. Okay, we only follow these questions and we just talk about all these things only and then nothing else. Then okay, 30 minutes done. Okay, stop talking. Get out. Yeah.
So you go by the flow.
Yeah, I go by the flow and also like on what you want to speak about. Yeah. Yeah. Because I have friends who will talk about like they talk about things like they talk about conspiracy theories.
Oh, serious?
Yeah, I talk about conspiracy
5G
theories. No, he talk about aliens and stuff like that.
Oh, serious?
No, he wanted to talk about it, but then he say, I don't want to talk about it. Yeah. There was something talk about football, talk about
okay. Wow, football podcast already.
Talk about cycling and stuff like that. Yeah. Because some of my friends, they all say, don't want to talk about work. Or they work in very sensitive locations, so they don't want to talk about it. So we talk about other things.
Talk about hobbies and stuff like that.
Yeah. Yeah, man. That's why, I don't know, but I just like to keep it casual. Yeah. And
which is good. Yeah. Like, I don't have like just a specific topic in mind. I can just speak about anything.
Yeah. So like, for example, let's talk about soccer. See, like, why you support Man U like that? Yeah, Man U losing, dude.
No more already, bro.
So who you support now?
Huh? I went to the blue side already.
Man City, right?
I go where the money is.
Yeah. It's not okay. I support Man City now. It's not because I follow the money. It's because it just got more interesting. Honestly, it's like Man U keep losing to those like lousy teams. And they like not consistent.
Yeah, it's just very inconsistent now, I would say.
After the whole Alex Ferguson era, it's like just confusing group of people already.
I think now with Oli, right, it's more, at least there's progress. But I feel like before that, it's really like, I don't know, there's just no, error, there's like no progress and the recruitment really sucks. I feel. Yeah.
But now also they don't have any interesting players, I feel. Like they say Mason Greenwood, all these are all very good. Or like coming, but their performance is on and off. It's not like Man City, like Phil Foden, Wow. So at least got quite consistent, Then at least they buy players like Kevin De Bruyne, Sterling, all these things. Or at least have some standard.
Yeah, I would say they buy the right players, Like Man U, I think so far the only best player they bought so far is Bruno, Like the best fit one so far. Yeah, the rest very questionable Yeah. A lot of the signings very questionable.
Yeah, they only stay for 1-2 years and they're out already.
Yeah, like previously they signed Sanchez.
Yeah,
like Di Maria,
Depay,
very just very questionable transfers, and they spend so much money on it some more.
Yeah, and all like no returns.
Yeah, exactly.
That's why they say that it's possible that the Glazers are going to get kicked out.
Oh yeah. Now there are a lot of protests against the owners.
They say never upgrade the stadium, never buy good players, or never buy like players that are like performing well. And I can't blame them I mean, cause they're businessmen
Yeah. Ultimately, they run the whole thing like businessmen.
But don't the other clubs also run the same way? Like Chelsea, I
think one very impressive one is Leicester.
Oh, the Thai guy, right?
Yeah, the Thai guy, yeah. So I mean, he's still a businessman, but I think the way he run the club is it's like a family. Yeah, so he really knows like the players and everything like that. Yeah, and the players really respected him a lot.
True.
Yeah, so when they won the FA Cup, you can see like he cried. He cried. I watched the video, the celebration. Yeah, so he was in the stands and he was crying, Yeah, then the players were like, we want to thank our owner. Then they asked him to come to the field to celebrate with them also. Yeah, like you don't normally see that. Like at most it's just the manager come and celebrate with you all, but owners usually don't come and celebrate with the players, Yeah, so for them it's like really respect, like they really have this relationship with the owners. Yeah.
I think Chelsea also, when they won the Champions League, who's the guy, Roman Abramovich. He still went down and went to say hello to everyone.
Yeah. So at least they still have that relationship there. It's not so bad. Yeah, but I think I don't know, Man U. I never see the Glazers like celebrate anything with the players before.
New York stock market and look at the Man U stocks. I thought maybe I should buy, but then no, I shouldn't.
Oh, really?
Yeah, but then the club is so shit. Don't buy
Yeah, don't buy.
Don't support them.
Huh?
I cannot really I cannot support them really.
I mean, I
many
still support them, but not say like a very die-hard Man U fan lah.
I expect them to lose, you know, the recent one, the
against Sevilla, is it? Villarreal, yeah. I also sort of expected it lah.
Yeah, I knew they were going to like flop at the last minute,
always like that one. Always like that. They have this habit of like flopping lah. Like the last season, a lot of semi-finals they went all flop. Yeah, a lot of semi-finals they went all flop. Then I say, what's new?
Yeah, I hate it. It's like they do so well, then they bring out expectation, after that they just lose.
Yeah.
It's like, forget it lah.
Yeah.
Got to support a winning team. Man City.
No, West Ham.
West Ham's doing well,
West Ham doing well,
Lingard.
yeah.
Wow, I can't believe it. They got what, 6 is it?
Yeah. That's why I see all these underdog, they perform well. Actually not bad eh.
Yeah, lor.
Yeah. Like Leicester, West Ham, all these. Everton also.
Yeah, Everton do not bad.
Yeah.
Liverpool
okay
not
lah,
bad.
yeah. Liverpool.
They're lucky to get 4th.
They were very lucky.
Yeah.
On the last day, they were very lucky.
They're lucky. But I don't know, I kind of stopped watching football for a long time already. Just follow the scores only.
Also nowadays don't really watch much.
Yeah.
Just follow lor. Just follow. Yeah. A lot of sports.
I was actually ask you, have you taken the vaccine already?
I taken my first dose. I'm still waiting for my second dose. Yeah, because a lot of slots is full, so they push back. I have to wait like 1 month.
1 month?
Yeah.
For the next dose?
I think it's around 1.5 months actually.
When do you take your first dose?
Last week, actually.
Oh.
Yeah. Actually, I signed up quite early already. Earlier part of the year.
How come you sign up after you get it already? How come I sign up? I don't get it.
Oh, because healthcare student ma.
Oh.
Yeah. So they are pushing like healthcare people to go and take.
Okay.
Yeah. So healthcare students also sort of like priority lah.
Okay.
To go and take.
Oh.
Yeah. That's why lor. Because now if you want to work in a hospital, right, it's more of like a requirement already.
Yeah, to get vaccinated.
To get vaccinated.
So technically you don't have a choice lah.
Yeah, if you work in healthcare, you don't really have a choice. Yeah. They say like, we strongly encourage you to take. But then, but it's a requirement to work. I was like,
so
okay.
you kind of have to lah.
Yeah, like no choice lor.
But do you choose whether you do the Pfizer one or the Moderna one?
Oh no, they didn't give you a choice. They say now only have Moderna. They don't really have stock for Pfizer.
Oh, okay.
Yeah. So I think you just take according to what stock they have lor.
Yeah, it doesn't matter, right?
Yeah.
But as long as it's not, yeah.
Yeah, it doesn't matter lah. I mean, I know there are people who are very particular. Like, I only want Pfizer.
Yeah.
Or I don't want both. I'm waiting for the Sinovac or something like that. Or some Johnson one. Yeah. So
understandable, the Sinovac one, the China vaccine.
Yeah.
Because I was getting my hair cut. Then the hairdresser tell me that a lot of our friends are waiting also for the Sinovac one. Because a lot of them are from China. And then China don't recognize the Pfizer and the Moderna. They only recognize the Sinovac. So no point they take those Pfizer and Moderna, right? Then they go back China and still get quarantined for 3 weeks or 2 weeks. They rather just wait for the Sinovac one. Yeah.
Makes sense.
Yeah, lor.
Yeah. But I know of Singaporeans who are not China, then they
also
want Sinovac. I don't know why.
Okay, I understand why. I mean, like, now China, I saw the vaccine rate, right? It's already, they're almost 1/3 done already.
Quite fast.
Yeah, that's almost like 500 million people already vaccinated. And all of them take Sinovac or Sinopharm. So I guess if 500 million people are okay with that, then I'm sure, if you take Sinovac, will probably be okay. Yeah, imagine, you take Sinovac, you die, then probably the 500 million people also all will have some problems.
Yeah, correct.
Yeah.
They also say like what? Oh, because the Pfizer, they so fast create the vaccine.
Yeah.
Maybe not enough research done, so I don't want to take.
How about, is it also the same one, right? Also quite fast also.
Yeah, also quite fast. So I think it doesn't really make that much difference.
Yeah, I got a friend who told me that the reason why it's so fast, right, is because they cut out a lot of steps in terms of authorization. Not in terms of the safety and all these things. They just cut out a lot of those waiting to get approved. They just push them to the front of the approval.
Yeah, like fast track, right?
Yeah. It's not because they just they just anyhow 1, 2, 3,
Correct.
Yeah.
I think a lot of companies like stop what they're doing or stop what they're researching on at point in time and really just focus on COVID. That's why it can be so fast.
Exactly.
Yeah.
So I guess it's safe lah. I mean, since this a long take also, so just take.
Akong already set example already.
I don't want to take because they say you cannot take, you cannot travel, right?
Yeah.
So you might as well just take. Yeah.
I mean, there's more pros in taking than they're not taking, right? Yeah. So
the cons is that maybe you die lah, but I mean, if I die, then probably someone else will take the die. So
Yeah, those who take before me will die already.
Yeah.
You know, that kind of thing.
So I mean, I'm like, just take lah. But I'm just waiting lah. I applied like 3 times already, but no response. So I don't know how come.
Your age group lah. Is our age group all, that's why.
No, but I have friends who are in my same course as me, right? Who got the vaccine already.
Oh, is it?
Yeah. I think I don't know if they are foreigners. Not foreigners, but they are like people who are living like not Singaporean but living permanently in Singapore.
Oh.
Yeah, they're working probably bonded to Singapore, but they already got their second shot. Then I was like, what? Singaporean not prioritized.
That's my priority.
Yeah.
My ping IC for what?
Yeah, lor. But I mean, looking at the whole situation, I don't really bother so lah. I don't mind being last also lah, cause like, I mean, I don't think I'll get. I don't think I don't know. I haven't met anyone who have COVID yet so far. So don't think I'll get COVID lah.
In Singapore, I think still quite safe lah. Yeah.
Yeah.
The rate of transmission not say very bad.
Really?
Yeah, I think in Singapore. I mean, consider how closely we live, you know, how closely packed we are. Yeah, to only have like 20 plus, 10 plus a day, I think it's not too bad already, I think.
But if you see the Facebook comments, people like outraged. Wow, so many.
Yeah.
Cannot lah. Lockdown.
Yeah. I don't know. I think a lot of people's reaction is like just very drastic.
Yeah, I think
or
people,
like over lah. Their reaction is too much already.
I think anyone who comments on Facebook are those people who are extremists.
Yeah, really very extreme.
Yeah. They just open a little bit. Oh, voila, must lock down. Lockdown too much. Too much lockdown already.
Yeah. Then when they lock down, they say, hey, when open? When? Wow, cannot.
Yeah, disrupting all the businesses. Then when open up a bit, hey, why the business all open up? Spreading more COVID.
Yeah. Why the mall so full? Wow, cannot. It's really...
That's why I cannot take it.
Singaporeans. Yeah. Like if you put yourself in like, let's say Malaysia. Yeah. Like if thousands of cases a day, then how?
Yeah,
like, wow, really jialat.
So that's why I say, that's why Singapore. I say anyone who comments on Facebook is just extremist.
Yeah, really. Yeah.
Have you seen the one in Japan where they say that? I saw like a video. They say that people who speak English spread more COVID virus. Like, are more chances to spread the virus than people who speak Japanese.
Oh, serious?
Yeah.
I never see it.
Because of the way we enunciate certain words, like the word P, like P. Then they put a tissue paper there, right? And then like the person say P, then
the tissue will fly.
Yeah, the tissue will fly. Yeah. But then they say certain word in Japanese, then they didn't fly like just like. So they say that there's higher rate of transmission because you speak English.
Oh, wow. Okay.
Nobody say P like it's what like so they don't enunciate so much of the P word.
That's why.
Yeah, but that's how it is lah.
Yeah.
So anyway, I think we can end it here since we really diverted a lot.
Okay. Hey, thanks for having me.
No problem.
It was great chatting with you.
Yeah, can't wait for you to start your work.
Okay, thanks.
Then maybe you can share me what you actually do.
Yeah.
Full time.
Yeah, can share with you more next time lah. Yeah, because now I'm also limited.
Yeah.
Because I don't know what I'll be doing next time also.
No, but you actually share a lot. I mean, I learned a lot from like just you as a student and all your attachments. You know, I learned. At least I learned what's on the surface of what a nurse does, and a bit deeper about what nurses actually do in the hospital. Which I think is good. Yeah. And yeah, hopefully everyone get vaccinated.
Please go for a vaccination.
Yeah, if not, give it to me. Just waiting, man. Okay, man.
Okay.
Thank you so much.
Thanks. Thank you.
Bye-bye.
Bye-bye.
Okay, let me just stop.